NHA CCMA exam practice. Question 1. A patient overpays a bill with a credit card. What must the CMA ensure when issuing a refund? Refund to any available card. Refund to the original method of payment. Keep the overpayment. Apply to an unrelated account. Refunds should be processed to the original payment method to maintain accurate financial records and prevent fraud. Proper documentation ensures compliance with accounting and regulatory standards. Question 2. Which scheduling system allows patients to choose any available time slot without pre-assigned categories? Wave scheduling, cluster scheduling, open booking, double booking. Open booking allows patients to select from available time slots without grouping or pre-blocking appointment types. While flexible, it may reduce efficiency if not carefully monitored. Question 3. A patient requests a prescription refill over the phone. What is the CMA's correct role? Approve the refill independently. Transmit request to provider per office protocol. Deny automatically. Call pharmacy and authorize. The CMA cannot authorize prescriptions. Their role is to document the request and follow office procedures to relay it to the provider for review and approval. Question 4. A claim is denied for lack of medical necessity. What should be reviewed first? Office decor, patient phone number, staff schedule, ICD-10 diagnosis code linked to CPT code. Medical necessity denials often result from mismatched diagnosis codes that do not adequately justify the procedure performed. Ensuring the ICD-10 code supports the CPT procedure helps justify reimbursement. Question 5. A patient wants to pay their balance in installments. What is the best administrative approach? Refuse partial payments. Offer a documented payment plan agreement. Send to collections immediately. Ignore the request. A written payment plan outlines terms clearly and protects both the practice and the patient. It promotes financial responsibility while maintaining positive patient relations. Question 6. What is the main purpose of HIPAA's privacy rule? Protect patient health information, regulate medical education, increase insurance costs, manage staff schedules. The HIPAA privacy rule establishes national standards to protect individuals' medical records and personal health information, ensuring confidentiality while allowing necessary information flow for patient care. Question 7. When posting insurance payments, what document details adjustments and patient responsibility? Remittance advice, appointment sheet, intake form, referral slip. The Remittance Advice RA explains how the payer processed the claim, including payments, adjustments, denials, and patient responsibility. Accurate posting from the RA ensures proper account balance. Question 8. A provider participates in a managed care plan. What is a key characteristic? Unlimited out-of-network access, pre-negotiated reimbursement rates, no referral requirements ever, no cost control measures. Managed care plans negotiate set reimbursement rates with providers in their network. This controls costs and often includes network restrictions and referral requirements. Question 9. Patient calls requesting test results. What should the CMA do? Interpret results for the patient. Refuse all communication. Guess the meaning of results. Provide results if authorized by provider. The CMA may relay test results only if authorized by the provider and following office policy. Medical assistants must not interpret clinical findings, as this exceeds their scope of practice. Question 10. Which action helps reduce claim rejections? Submitting incomplete forms, delaying submissions, ignoring coding updates, verifying patient demographics and insurance before visit. Verifying demographic and insurance details in advance prevents common errors such as incorrect policy numbers or inactive coverage, significantly reducing rejection rates. Question 11. A patient refuses to sign the HIPAA acknowledgement form. What should the CMAA do? Deny treatment automatically. Document the refusal. Force signature. Ignore policy. Patients are not required to sign the acknowledgement, but the practice must document that the notice was offered. Documentation ensures compliance without violating patient rights. Question 12. Which organization maintains and updates CPT codes? CMS. Who? American Medical Association. OSHA. The American Medical Association, AMA, develops and maintains CPT codes, which describe medical procedures and services for billing and reporting. CPT codes are updated annually. Question 13. A patient's claim requires coordination of benefits. COB. What does this involve? Choosing a random payer, determining primary and secondary insurance responsibility, billing both simultaneously without order, canceling one policy. COB determines which insurer pays first, primary, and which pays second, secondary. When a patient has multiple insurance policies, accurate sequencing ensures proper reimbursement. Question 14. What is the purpose of an audit trail in an electronic health record, EHR? Track employee vacations, schedule appointments, print prescriptions, monitor access and changes to records. An audit trail records who accessed or modified patient records and when. This supports accountability, compliance, and detection of unauthorized access. Question 15. A patient requests confidential communication to a different mailing address. What must the practice do? Ignore the request. Honor reasonable request under HIPAA. Charge an extra fee. Notify other patients. HIPAA requires covered entities to accommodate reasonable requests for confidential communications, such as sending mail to an alternate address to protect patient privacy. Question 16. Which term describes the fixed amount a patient pays at the time of service? Deductible, premium, copayment, capitation. A copayment is a predetermined fixed amount paid by the patient at each visit. The CMAA should collect copayments at check-in to reduce accounts receivable. Question 17. What is the main function of accounts receivable, A/R? Hiring staff, tracking outstanding balances owed to the practice, coding diagnoses, filing charts. Accounts receivable management ensures timely collection of payments from patients and insurance carriers. Monitoring A/R aging reports helps maintain financial stability. Question 18. A provider is credentialing with a new insurance plan. What is the purpose? Purchase equipment. Verify qualifications and participation eligibility. Increase rent. Advertise services. Credentialing confirms that a provider meets professional and licensing standards required by insurers before being allowed to bill and receive reimbursement. Question 19. Patient's deductible has not been met. What does this mean? Insurance pays 100%. Patient must pay covered expenses until deductible is satisfied. No payment required. Copay waived. A deductible is the amount the patient pays out of pocket for covered services before insurance begins to pay. The CMAA should explain financial responsibility clearly before services are rendered. Question 20. What is the purpose of OSHA regulations in a medical office? protect workplace safety, regulate billing codes, approve insurance claims, schedule patients. OSHA establishes safety standards to reduce workplace hazards, including bloodborne pathogen exposure, chemical safety, and infection control practices. Compliance protects healthcare workers and patients. Question 21. A patient requests a copy of their billing statement. What is required? Deny access. Verify identity before release. Email without verification. Provide another patient's statement. Even billing information contains PHI. Identity verification prevents unauthorized disclosure and maintains compliance with privacy regulations. Question 22. What is capitation in managed care? Payment per procedure. Fixed payment per patient per period. Payment only after deductible. Bonus for late billing. Capitation is a payment model where providers receive a fixed amount per enrolled patient per period, regardless of services rendered. It emphasizes cost control and preventive care. Question 23. Which code set is used for supplies and certain non-physician services? ICD-10-CM, CPT, HCPCS Level 2, DRG. HCPCS Level 2 codes cover supplies, equipment, and certain non-physician services not included in CPT. They are commonly used for Medicare billing. Question 24. A patient fails to show for multiple appointments. What is an appropriate administrative step? Ignore the pattern. Implement office no-show policy. Automatically discharge without notice. Bill insurance. Consistently applying a written no-show policy promotes fairness and reduces lost revenue from missed appointments. The policy should be clearly communicated to patients during registration. Question 25. What is the primary purpose of patient pre-registration? Increase wait times. Collect and verify demographic and insurance information before visit. Avoid documentation. Eliminate consent forms. Pre-registration streamlines check-in, reduces errors, verifies insurance eligibility, and improves workflow efficiency. Accurate data collection before the visit minimizes claim denials.